Today we're going to be talking about a very interesting subject that we have many clients that have been requesting this subject. It's going to be the truth about Ozempic. So today we have a wonderful guest. We have Dr. Sandy with us today. So she's going to be sharing with us different information about cost, also the long-term run, if it's efficient, if not. So she's going to be explaining a lot of different subjects about Ozempic. Also, at the end of this webinar, we're going to have a raffle for you guys. It's a promo price, so you're going to really enjoy it for you to book your surgery. So pay attention to the information that Dr. is going to be sharing, because at the end we have a really nice gift for you guys. Perfect. So welcome, Dr. Sandy. How are you?
Thank you, Lisa. Fine. Thank you. And you?
Good, thank you. So we're going to go ahead and start. I'm going to put the presentation for you guys to stay with it. So let me just put it on right now. Okay, so before we start, I wanted to just jump into who we are. TreVita. Well, we work with our clients to ensure the procedure that they select is the best to accomplish their goals. We work with extremely vetted doctors like Dr. Sandy that are board certified, and also work with really nice facilities that provide the best care for our clients. Also, we help you with post-op, booking, prior, post, so for your experience to be 100%, and your safety is our #1 priority. I'm one of the coordinators here at TreVita, so if you book a surgery, I'm going to be helping you with everything that is pre-op, post-op, and just making a really smooth transition from your hometown to Tijuana and going back home. Dr. Sandy, you can talk a little bit about your credentials and what you're doing lately with us.
Well, hello. It's nice to be with you. And well, I'm a weight loss surgeon, and I am affiliated to TreVita. So right now we are going to give you a talk about the comparison of Ozempic and bariatric surgery. So we all know that obesity and overweight are conditions that extend beyond aesthetics. So this will impact our health and our quality of life. So all of you already know this, and congratulations for being here, because it means that we are trying to improve our life, our quality of life, and addressing these issues require approaches that go beyond temporary solutions. So here we have to focus on lasting and sustainable lifestyle changes to be able to do a permanent solution, a long-term solution to obesity or overweight. And here is where we are going to compare the two options that are the most common out there that we can hear about, and it's Ozempic and bariatric surgery. So how does it work? How does Ozempic work, or how does it get us to lose weight? So what it will do is increase satiety. It will make us feel full for a longer time and reduce how much food we are intaking. So this is the main reason why we're going to lose weight, and it slows down how the stomach will start to empty. So food stays a little bit longer inside our stomach, and this will extend the time that we feel full. This is important. We will talk about it a little bit later, but it's important that we know that this effect is only when we are using Ozempic. It won't be life term. It's just while we are using it, it increases satiety and it slows down how the stomach empties. But as soon as we stop using Ozempic, we will start eating as we are eating previously. Now, compared to bariatric surgery, what we are doing is a permanent modification to our intestinal or our gastrointestinal tract. So here it's very important. We are reducing the size of our stomach in case of a gastric sleeve, or we are bypassing a part of our bowel that we will not be absorbing, or we are doing a combination of a sleeve and a bypass in the case of a duodenal switch. So here we are doing a permanent modification to our stomach, to our bowel, so we are absorbing less and we are eating less life term. So this is what is going to give us the better results or the best long-term results. This is very important that we compare. What are the side effects of Ozempic? The most common that we can hear in our patients is nausea, vomiting, and constipation. There's bloating, abdominal pain, and this is a very, very frequent side effect of Ozempic. As well, we can see that we can have hypoglycemia. This is where the levels of sugar in our blood go down, and this is because as well Ozempic is used to help us level our sugar levels. We can have gallbladder issues such as gallstone or inflammation of the gallbladder, inflammation of our pancreas, and some kidney function issues. But the most common is the gastrointestinal issues, where we will see that we have abdominal pain, cramping, distension, constipation, and nausea in practically all our patients. So here we can see that these both are treatments for obesity, but we have to see which one will provide us a more long-term result. So here in Ozempic, we have temporary benefits where we will have weight loss and we will have certain control in diabetes, but this will require the continuous use of Ozempic to have the effect that we are talking about. In bariatric surgery, this is a long-term solution, and here we have a permanent change to our digestive system, and we will see the effects long-term without continuous use. It's one-time procedure. And here, the outcomes, it's very important to know how much weight we are going to lose when either one of the treatments. So with Ozempic, we can see that the weight loss will be approximately 5 to 10% of the excess of our weight, and it will be during the use of Ozempic. This is the top results that we will see using Ozempic. In bariatric surgery, we have all heard, depending on the procedure that we choose, we can have from 50 to 80% of weight loss in the first 1 year, year and a half. This is the excess of weight that we have. We will see from 50 to 80% of loss in this percentage of excess of weight. And then 10 years after surgery, we can see 15 to 30% of maintaining that weight loss that we had in the initial part. Why is the percentage that low? Well, we know that there are a lot of patients that do not work a lot with the procedure. So this is what we can see scientific evidence of the long-term results in patients that do not follow a lot of the guidelines or the recommendations that we are giving them. So just because of the procedure, we can see that they will maintain from 50 to 30% of the results. Compared to Ozempic, where we will see that when we start using Ozempic, we start regaining the weight. So, for example, a patient that has 400 pounds, we can see that with Ozempic, they will start losing approximately 40 pounds top, and the same patient going under bariatric surgery can lose up to 200 pounds. So it's very different, the results that we will have in the initial part, and long term as well. We can see very, very different results. Previously, bariatric surgery was a very aggressive procedure where we had to do it open incision, where the recovery was very slow. We have to be in bed for a week, then the recovery was very, very slow. Right now, we offer minimal invasive surgery. All the procedure is through laparoscopic approach, so the recovery is very fast. As we can see in the image, the incisions are 1 centimeter to 0.5 centimeter, so very, very small. This is what gives us the pain after surgery. So in the previous open incisions that we had, it was very, very painful in the recovery. Right now, we do not experience pain. What we experience is certain part of uncomfortable discomfort because of the gas that we use to be able to perform the surgery, but it will not be pain as that. And the recovery will be very fast. We see the patients walking since day one, going to the bathroom by their own, up and down stairs. So the recovery is very, very fast, and you will be able to get back to your normal activities in a week or two. The cost as well, we can see a big difference depending if you are a patient that has to pay by yourself or you have insurance that covers it. But if we would have to pay it out of our pocket, we can see that Ozempic is very, very expensive compared to bariatric surgery that is one cost only. And it can be the double the price or more depending on the procedure that we are choosing. But the cost is very, very different. So here we just have a resume of what we have talked about, the effectiveness of both treatments, the health outcomes. We do not have to repeat it. If you want to as well, we can send you this image so you can compare it. But it's very, very different regarding long-term results and regarding costs. So, for example, if you were paying out of your pocket for Ozempic in the United States, or you are choosing to go through the TreVita process and coming with us to have a bariatric procedure, then it would be practically half the cost to have a gastric sleeve, for example.
So right now we're gonna dive into the live Q&A. So if you have any questions, please send them to our chat box. So we're gonna start with them. But Dr. Sandy, I do have some questions from some clients that they already sent before. So I'm gonna be asking those. From your patients that you have, 80% of them come from the United States. Do they come with a lot of information of not having all the information about Ozempic, like you explained? They first go through Ozempic and then they come to you. How is that relationship? Do you see that it's going more and more often right now, that clients first try Ozempic and then they come with you?
It depends on the treatment that their primary physician recommends. There are some patients that come first with the treatment of Ozempic, and after the failure of the treatment, then they recur to bariatric surgery. It's very, very different each process, but we have not seen very good results. I think that there are patients specific for Ozempic. A good example would be a patient that does not qualify for bariatric surgery, that does not have the normal weight, but does not qualify for bariatric surgery. I would put an example, a patient with 27 of BMI. So here we cannot perform a bariatric procedure, but needs help to lose weight, so they try with Ozempic, and as well has chronic diseases like diabetes. Here it would be the perfect patient to try with Ozempic because we are overweight, but we are not qualifying for bariatric surgery, and we have to control our glucose levels. So this would be a good candidate for Ozempic. But in case that you are looking into bariatric surgery, the most probable is that Ozempic is not for you.
So it depends on your BMI most likely.
Of course.
And clients that have a higher BMI, long-term, this is not the best suit for them.
As well, something that is very important to know is that through bariatric surgery, we have remission of chronic diseases like diabetes, hypertension, sleep apnea. We have remission depending on the procedure that we choose. So this is very important compared to Ozempic, where we will see that maybe it controls our glucose levels, but just that. And as soon as we stop using it, then it will just go up again.
So you're saying that with a bariatric surgery, you can get away from those diseases, and if you have Ozempic, once you stop using it, you're going to continue having the same problem.
Of course.
It doesn't fix it.
It doesn't resolve it.
Okay, perfect. So we have Jacob that sent a message saying, as an EMT, I encountered cases where patients suffer from severe side effects of Ozempic, especially when they use it for weight loss purpose. How can we address this misinformation surrounding it, especially when we see it everywhere in the States, that we see it on TikTok and Instagram? How can we address all of these side effects that Ozempic is causing, especially that she's in the medical industry? She's being seen like more and more and more clients, patients are having these side effects.
Well, I don't know exactly through what process they go through to take the decision of putting a patient in Ozempic. there in the United States, but this is just it's regarding ethics. So if I know that my patient is not a candidate for Ozempic, then I shouldn't recommend it. That's all that I can say about it. And it's very important that any decision that you are going to take or any treatment that you are going to go under, you have to investigate, you have to do your research, see what results it has, see what side effects. As well, I cannot tell you that bariatric surgery is magic. I cannot tell you that you won't have any risk of complications, but when a patient comes to me and asks for bariatric surgery, I have to tell him, okay, this is the good part, this is the bad part, this is the side effects, these are the risks of complications, and I have to explain to the patient all of it regarding bariatric surgery, not just the good part. I have to explain everything so they can take an informed decision.
Correct, to make sure that they have the correct tools to make the best decision for them by doing their investigation and just making sure that their decision is the correct one.
Exactly.
We also had Anna, she was sent a question. She said that once you're away from Ozempic, is there any withdrawal system associated with it or for extended periods? If you continue to use it, does your body have any withdrawal of wanting to continue this medication?
No, there's an adjustment where we can see if we have a diabetic patient and they do not have a good control of the glucose levels, then we have to adjust the dose, and there's a process to see exactly what dose the patient needs, but that would be practically, yeah.
Okay, perfect. Also, can you tell us long term? I know you explained it a little bit about the side effects, but the titer, like cancer associated with Ozempic, and the diseases that can cause by using it compared to bariatric surgery, how one has not a lot of side effects and Ozempic does have a lot of diseases that can be caused, especially right now that it's being such a boom in United States.
The more that they are using it, we will be able to see more and more side effects of using Ozempic, but it's very important to do the correct investigation. You will find a lot of diseases that are related, but the most common side effects that you will see are the ones that we talked about regarding our digestive system. That will be the most common complaint practically in all our patients. And then the other diseases, yes, you will hear certain cases, but it's not that common as the gastrointestinal side effects.
Perfect, I see. So definitely Ozempic is something that has a higher risk and you start seeing more diseases compared to weight loss surgery.
Like everything, we have to use it in the correct situation. And if we are candidates for bariatric surgery, the most probable is that we are not candidates for using Ozempic.
Yes, especially you mentioned that with Ozempic, you're only able to lose 5 to 10% about your excess weight. And
exactly.
You've seen in your patients that with a weight loss surgery, they're able to lose up to 70-80% of their excess. And this can happen in the first year, correct?
Yes, year and a half is where we see the most weight loss. And we can see, depending on if we have a gastric sleeve, 50 to 60% of the excessive weight, and up to 80% in a duodenal switch.
So depending on the procedure and their BMIs, the weight loss that they're going to have.
And of course, because some patients tell me, and what's going to happen with the other percentage that I'm not losing? Well, this is because of bariatric surgery, the results that we're going to have. But if we have a very good patient that sticks to our recommendations, that starts doing physical activity, that starts doing the modifications that they need to do in their eating habits, of course, we can have even better results. So it's very important to work with the procedure to have the best results.
With TreVita, we do work with the dietitian, with the post-op care, so with the procedure performed by yourself and the whole post-op care that you're encountering with the TreVita team, we really make sure that you're post-op journey is 100% successful. That's why we have a whole post-op program. Dr. Sandy is with us, a dietitian. We have daily checkups. So it's very important. And also that's going to jump into my next question is that we're seeing more that clients that do Ozempic, they don't even have the follow-ups. And it's something that you should really have. Can you share a little bit about why it's so important to check in with your primary and have those follow-ups?
Yes, you have to have a follow-up. Here, you're not by your own. You will be having a follow-up by the TreVita team and by the medical team. So this is very important. And as well, I always tell my patients, you have to go to your primary physician as well to do adjustments to all the medications that they are taking and that probably they will stop taking. So it's important to do it by the hand with them. Start doing modifications to the doses until they stop using it completely. But it's very, very important to always have a good follow-up.
Perfect. So Dr. Sandy, before we end the live Q&A and jump to the winner of the question, what can you tell clients or for you patients that are on the edge of going through the route of Ozempic or the route of performing a bariatric surgery? Any advice or anything that you wish to say before making the right decision for their long-term health journey?
Yes, so make an informed decision. That's the most important part. Have different opinions. If you're looking to bariatric surgery, have a consultation with your surgeon. And the most important as well, looking into bariatric surgery, is looking for a surgeon that can offer you all type of procedures, and you can take a decision with all the options. So if I am a surgeon that I can only perform a gastric sleeve, then I will offer you a gastric sleeve, even though you need another procedure. And this is very important as well. We have had a lot of patients that come to us with chronic diseases, with very, very high BMIs, very young patients where we see that they have to maintain the weight loss for a long, long time. And they come and they tell me that their surgeon recommended gastric sleeve. So if you go to a surgeon that cannot offer you all the options, then the most probable is that they will offer you the only thing that they can do for you. And this is not going to be the best decision. So it's very important to make an informed decision, look for different opinions, and then take the best decision.
Thank you, Dr. Sandy. So that's why here in TreVita we do an excellent job in working with doctors that are board certified as Dr. Sandy to have the correct credentials, for have the correct post-op care, the dietitian, everything on board, because you really want to have a long, healthy journey and not coming back for revisions or anything of those cases. Is there any other questions in the live QA? Can you please send them over? Let's see if on Instagram we have anything. We have clients that already went with you saying hello, Dr. Sandy. They're very excited. They're coming next week to start their new journey. Stan, we're really happy to have you next week. Jessica, perfect. So yeah.
We have a patient that said, it messed my stomach up and gained all the weight back immediately after stopping.
So that's what you mentioned. As soon as they stop using Ozempic, they continue to gain the weight fast. So it's really important to make a very informative decision. So we have a question. Whoever answered the question correctly, they're going to receive $300 off their total surgery. For any new customers that haven't booked their surgery with TreVita. So the question is, what percentage of weight loss do people typically lose with Ozempic? So Dr. Sandy shared about the difference before we give out the answer. With weight loss surgery, it's 70 to 80. With Ozempic, it's another amount, a percentage. So let's wait to see if we have somebody that can answer that question. Alex, yeah, so the correct answer is 5 to 10%. Definitely Ozempic is, the percentage is way lower than any bariatric procedure. So yes, Alex, you're the correct winner. So we're gonna be reaching out for your price so you can book your surgery. So yes, any other final thing that you want to go over, Dr. Sandy, or share?
No.
Thank you, you guys. It's very important to do an informative decision to really look into different options and make the correct one. I'm going to be putting right now the information for TreVita. If you want to have any consultation, please let us know. We're more than happy to share with you the information or answer any questions you may have. So this is our phone number. It's 866-858-5593. You can also follow us on any social media and send us a message, and we're more than happy to answer your questions. Well, Dr. Sandy, thank you so much for your time. Thank you for sharing your knowledge for any potential client that wants to come in with TreVita and start their weight loss journey.
Yes.
I really appreciate it.
We're waiting for you here in Tijuana.
Yes. Thank you, guys. We'll be in touch for the next webinar. Thank you.